back. You're watching Startup Central with me, Nayantara Rai. I don't know about you, but I've had heart disease in my family. And I remember thinking so many times, gosh, I wish I knew that there was a heart attack coming. And our next guest tries to solve that big problem. It's the health tech startup that has also won a recent award by the Union government and Ayushman Bharat. My next guest is Dr. Charit Bhograj, the CEO of Tricog Health, which has saved already 1.3 lakh lives. Let me tell you in a nutshell what they do. Remotely, they figure out and issue a red alert that a heart attack is coming or some critical care that you might need and you need to go to a hospital really soon. It can be by a wearable device, but they also use cloud computing with the devices that they deploy. Dr. Bhograj, thank you so much for joining us here. 4 million strong user base, 1.3 lakh lives you have already saved. So what is it? You rely on ECG, but a lot of doctors also say every ECG is going to show a variation. So these are what, live ECGs that keep happening?
That is correct. And as a cardiologist, the single largest problem that I see for us here in India is the lives lost unnecessarily due to cardiovascular disease. So all of us know, for instance, that if you treat a patient with a heart attack within the golden hour, which is 60 to 90 minutes, you are able to save lives. But what most people do not know is that the average time in which a patient with a heart attack is treated in urban India is close to 360 minutes, an additional 53 minutes when they enter the hospital before they get treatment or angioplasty. So Tricog was started with that clear aim, is that can we give every person with a heart attack from an 80% chance that the heart attack will take your life to an 80% chance that you will survive. And what we have done so far, we've touched the lives of 4.1 million people, majority of them here in India, is that we enable healthcare practitioners in clinics, hospitals, and nursing homes across the length and breadth of this country with a cloud-enabled ECG machine made by Wipro GE. The data is sent to the cloud where our AI algorithm diagnoses whether there's a heart attack or not. This is then verified by a team of specialists, and that report goes back to that remote center in any corner of India or the world in 6 minutes. So in 6 minutes, Tricog enables healthcare practitioners anywhere to diagnose their patients with heart disease. And we go one step further, that if we find a problem, we will then connect them to a tertiary care center or a secondary care center where treatment can be given. So I'm very proud that we have helped over 4.1 million patients during the 5 years we've been in operation.
Dr. Bhograj, can you tell us a little bit of what is it? Is it a wearable device that your consumer base or your users have on them all the time, and that's what keeps calculating the ECG? Where do they wear this device, and how much does it cost?
Thank you. So our customers are clinics, hospitals, and nursing homes. And what we do is that we enable them with a cloud-enabled clinical grade 12-lead ECG, which is FDA approved. This ECG, so you go to your healthcare provider and a Tricog ECG is done at that center. And that is how we're able to diagnose whether you have a problem or not remotely. We've also working with multiple partners on the wearable devices, and the wearable devices is for diagnosing arrhythmias, which is atrial fibrillation and causes strokes, and other complicated arrhythmias that can take your life and lead to sudden cardiac arrest, especially in the post-discharge space. So clinical grade 12-lead ECGs where we get data from, and also wearable devices for arrhythmia diagnosis. This is the data from which we get our ECG data from, and our AI which is our core IP, is responsible for sifting through this data in real time and coming up with the diagnosis.
So can you also tell us a little bit about, so what happens? Let's say I go to my hospital or a clinic and I agree to get this device. where is it strapped on, and I get a call from you or a message or what saying that you need to rush to a hospital right now.
So I'll give you an example, and the simple fact that in across India, the doctor-patient ratios are very skewed, and in COVID, even accessing healthcare has become a significant issue, especially for non-communicable diseases such as heart attacks. So if you were to have any symptoms, what you would do is that you would go to a Tricog enabled medical center, which is your closest clinic, your GP's clinic, or a nursing home, or a larger hospital. It is in that location where a standard clinical ECG is done by placing the leads across your body and your limbs, and an ECG is taken. So this is how we are able to diagnose whether or not you have a problem. And in case that you do, within 6 minutes, you will receive an alert and a call from our medical team, which will then take you through the next steps, as well as connect you to the closest center where treatment can be done. Uh, Also start treatment exactly from the location where you are in, so that no time is wasted.
And as they say, the first hour is, of course, the golden hour. That's when you don't get healthcare, that it becomes even more risky and difficult to save someone undergoing a heart attack. Dr. Bhograj, thank you so much for joining us on this edition of the Startup Central. It's been a pleasure having you here, and we look forward to many more interviews. Ladies and gentlemen, with that, we're completely out of time. Many thanks for tuning in.